Thank you. Thank you. It's wonderful to be here today to have a few minutes to tell you about the Bloomberg Fellows Program. The woman, the voice of God, mentioned that we're with the Bloomberg American Health Initiative, which is a project launched in 2016 at the School of Public Health at Johns Hopkins to address some of the most pressing challenges affecting public health in the United States. The areas where we work are addiction and overdose, environmental challenges, obesity and food systems, risks to adolescent health, and violence. A core component of the initiative is the Bloomberg Fellows Program, and I am thrilled that we have two of our amazing fellows with us today. Bloomberg Fellows earn a full scholarship to receive a Master of Public Health degree from the Johns Hopkins Bloomberg School of Public Health. But what makes the program unique and different from other scholarship programs is that the candidates have to apply in partnership with the organizations that they already work for. This is a way for us to develop not only a network of students, but also a network of organizations around the country that are on the front lines of these 5 challenges. Upon completion of the degree program, the students have to commit to spending at least 1 additional year with the organization that they're working for so that they can take the tools that they've learned in the program and apply them in their communities. It's important to note as well that we are not looking for the usual suspects. We are looking for candidates who might not necessarily consider themselves squarely in the world of public health. So for example, we might look for somebody who works in law enforcement and can use the tools of public health to address violence or addiction in their community. We might look for somebody who works for a school system and can use the tools that we can provide to address risks to adolescent health. And so we really want people who maybe weren't already thinking about getting an MPH degree, but who could really benefit from what the school has to offer. So I'm joined today by Kelli McIntyre and Wheelock, who are 2 wonderful fellows from our inaugural class, and they've been in the program for about a year. I'm going to start with Kelli. Kelli is the physical activity coordinator for Get Healthy Philly, which is the chronic disease prevention arm of the Philadelphia Health Department. Kelli, can you tell us a little bit about your work on the ground in Philly and also why you applied to the program?
Sure. Thank you all for having me. I'm really honored to be here to share our work at Get Healthy Philly, which is really around reducing the extremely high rates of chronic disease, such as hypertension, diabetes, obesity, and other conditions that disproportionately affect low-income Philadelphians and are actually, at this moment, killing more Philadelphians than any other cause. My role in that is to think about physical activity promotion for adults. So specifically thinking about and working with other city departments, streets, transportation, parks and recreation, planning, and also working with community organizations to kind of get a grip on what the challenges are that Philadelphians face when it comes to being active in terms of walking and biking. I also work very closely with other organizations that provide free and low-cost ways to be active and work to connect people to those opportunities, and in some cases subsidize that work. And I have to say that's one of the most exciting parts of my work. Love offering a free yoga class in the middle of North Philadelphia that is packed to the gills on a Saturday morning with people that have never tried yoga before. And then another part of the work is working with Philadelphia employers to consider workplace considerations because many adults spend most of their time at work. So thinking about opening and unlocking and making your stairs attractive and promoting their use and having accommodations for folks that choose to walk or bike to work so that they don't have to be sweaty all day. So working with Philadelphia employers is another part of that work.
Great. Haven is the Syringe Services Coordinator for Outside In, which is a service provider for homeless youth and other marginalized populations in Portland, Oregon. Haven, can you tell us about the work you do day to day in Portland and also about why the program appealed to you?
Yeah, so I have been running our syringe exchange program now for almost 12 years. And so I work every day with people who are actively using primarily heroin and methamphetamines, which is different than what we see on the East Coast. We see a lot less methamphetamine use here. But I get to engage with these brilliant, beautiful, wonderful people and just really help them learn tools and provide tools that allow them to improve their health and their well-being. We have a primary health care clinic for folks who are homeless and live outside. 80% of our clients to our medical clinic are homeless. About 70% are on Medicaid. The other 30% are not able to access insurance for many reasons. And I just basically like to provide love and tools and support to people who are active in their use and help them get the tools and skills that they need to change in whatever way is most helpful for them.
Great, thank you. So as I mentioned, the initiative is taking on some pretty tough challenges that are affecting health in communities across the country. Why do you think the tools of public health are important for people who are on the front lines confronting these challenges? Given?
I would say we wouldn't have this many people experiencing these health concerns if it wasn't, it's not about the individuals, right? The individuals are doing the best that they can, but if this many people are suffering and sick in these ways, there has to be something with the system that is not working. And a lot of these issues are all tied to the same root cause. And so what appeals to me about looking at all of these issues from a public health perspective is that that's where we learn those tools to change the system. And the whole thing about like going upstream in public health, if we don't address these root causes, then we're not going to get to where we need to go.
Kelli?
Not to echo what Haven said, but I guess I would just add to that I think the public health approach of involving partners and working together and having a seat at the table for everyone and having the communities that you're serving be the expert in the areas of their community is a really important part of the solution to these really large issues. And I would also add that the public health approach of thinking about the most vulnerable of the populations and making sure that we're bringing the most vulnerable folks up to the same level and thinking about equity and all that we're doing is an important approach to solving these problems too.
Great. So you both have been in the program for a year, and I should mention that Haven and Kelli are both part-time students, which means they're still in their positions in their home communities, and they're taking classes mostly online in the evenings and on weekends. So since you've been working in your jobs and also taking classes at the Bloomberg School, how has the program affected your work?
So I will say that I'm really excited to be able to learn from thought leaders in the field at Hopkins about public health communications, how to translate science, and how policy really gets changed, and how we can really work to address some of these big issues. It's important to learn from those thought leaders, but I cannot discount how important it's been to be able to have these other fellows that are brilliant and doing amazing work across the country and to be able to reach out to one another, not just for help with school, but also for help in the things that we're doing at work.
That's wonderful.
Yeah, and I would echo that too. I mean, when you're on the front lines of some of these super intense and emotional health issues that we're dealing with, and I mean, through my work, I've seen a client die once a week for the last year and a half, right? It's devastating to these communities, and it's devastating, and my heart breaks. And knowing that I can call Kelli and be like, dude, I'm not alone, am I? Like, I'm not losing my mind, has been really beautiful and wonderful. It's also just been really great to like learn these new tools and ways of thinking about things that like I knew in the back of my head, but I didn't know I knew that well, right? It's been validating to feel like I belong at the table because I come from a very non-traditional background. I didn't finish high school. I lived outside. So the fact that a person like me can sit in this room is really validating, and that's something I don't think without the fellowship I would be doing right now.
Well, I want to say we're thrilled to have you. We're thrilled to have both of you. And so we are running out of time, so I'll just say that you can learn more about the Bloomberg American Health Initiative and the Fellows Program on our website, which is americanhealth.jhu.edu. You can listen to our podcast there, sign up for our newsletter. You can also follow us on Twitter. We're at American Health. And we have a table just outside, so if you have questions about the fellowship or want to get more information or materials, you can stop by.